Hi, beautiful people. How are ya? I hope you're having a great day.
With you, I can be sad with you. Just take my hand and fly up through the dreams where the skies are so clear.
This morning, I was woken up by Tesla, didn't you? At 6 o'clock in the morning. You should be tired. Normally, he'll lay there until I wake up, usually around 8 or 9 in the morning. But today, he was whining and sniffing my ear to wake me up. And then I realized I heard barks, and they weren't just in my dreams. It was real barks. And Tesla knew it, didn't you, baby? Yes. Goldie had woken up before me and got herself stuck between the chair and end table in the living room. I think she panicked a little bit because she got stuck there. She couldn't get out. She rarely barks. And usually she barks because Tesla's annoying her because she's trying to sleep. That happened just a little bit ago. Tesla can't get off our bed because it sits too high. So he's stuck on the bed because he sleeps with us until I get up in the morning. But he knew something was wrong and was letting me know, weren't you? So I woke up and heard Goldie bark, grabbed Tesla and said, "Where is she?" And he zipped straight to the living room where I found her. I have a very loving, caring dog here. He knows when something's wrong, don't you, baby? Yeah, I knew something was wrong. Goldie's gotten stuck in other places in the house before, like between my bedside stand and my bed. There's, cords and such there, and she's gotten stuck in there. I think she's getting senile and she just wanders around and goes into places she would normally never go. But anywho, she was so happy to see me. I pulled the chair out and grabbed her in my arms, and my sweet old pup was safe. And Tesla, well, when it comes to like a sad scene in a movie and I cry, which doesn't take much, I cry easily in movies when watching movies, but he will hear me and instantly come up and attempt to console me, and lets me cuddle him, and that always makes me feel better. And I believe that's what he was doing for Goldie this morning, right? Mwah. Mwah. In 2014, Jared Younger, Luke Parkitney, and David McLean wrote a research paper on the use of low-dose naltrexone as a novel anti-inflammatory treatment of chronic pain. They reviewed the evidence that LDN may operate as a novel anti-inflammatory agent in the central nervous system via action on microglial cells. They stated that its effects are unique and different compared to its better-known activity on opioid receptors. So what is low-dose naltrexone, and what can we learn about its effects on fibromyalgia? That's what I'd like to talk about today. Here we go. Low-dose naltrexone, or LDN, is considered a safe, non-toxic, and inexpensive drug that helps regulate a dysfunctional immune system, according to LDN Research Trust. It reduces pain and fights inflammation. It's used to treat cancers, autoimmune diseases, chronic pain, and mental health conditions, to name a few. In 1984, naltrexone was approved by the FDA in the United States of America for treatment of opioid addiction at the dosage of 50 to 100 milligrams per day. It's an inhibitor, so there isn't a narcotic effect, but in low-dose form, it's a tenth or less of that standard dose at 0.001 milligrams to 16 milligrams in clinical practice. Most research studies have used 4.5 milligrams per day, a little more, maybe up to 6, and a little less, maybe down to 3. Low-dose naltrexone binds to the endorphin receptors for about an hour and a half, and the blockade lasts 4 to 6 hours. The effects of LDN are analgesia and anti-inflammatory. Analgesia is the inability to feel pain, and anti-inflammatory is when a drug is used to reduce inflammation. On top of that, it increases the production of our own endorphins. Endorphins are neurotransmitters and hormones that are released by the brain in the hypothalamus and pituitary gland to alleviate pain and promote pleasure. Endorphins also improve mood, reduce stress, depression, and anxiety, boost self-esteem, and support memory and cognitive function. Sounds like a good thing, right? Our well-being is supported. There is also some evidence that LDN can have a positive effect on individuals with chronic fatigue syndrome, MS, and neuropathy because of its effect on immune function. Low-dose naltrexone is a generic drug and is cost-effective, but must be compounded at a special pharmacy, from what I've read. Since regular pharmacies use the dosage of 50 milligrams, but the cost of LDN is about $50 per month. If you have Hashimoto's thyroiditis, use this medication with caution. The reviews from individuals as a treatment for fibromyalgia had an average rating of 6.8 out of 10 from 64 reviews. 61% had a positive experience, and 27% reported a negative experience. Not all medications work for everyone. The dosage should begin at lower doses than 4.5 and gradually be raised over time for individuals to tolerate it well. LDN is considered a glial cell modulator. It modulates toll-like receptor 4, or TLR4, signaling that are found on macrophages such as microglia. It's believed that the non-opioid antagonist path is what has the anti-inflammatory effects of LDN. Microglia are central nervous system immune cells that are activated by a wide range of triggers. Once they are activated, microglia produce inflammatory and excitatory factors that can cause sickness, such as pain sensitivity, fatigue, cognitive disruptions, sleep disorders, mood disorders, and general malaise. So, as an antagonist, LDN interferes with those symptoms. There's a high degree of symptomatic overlap between fibromyalgia and cytokine-induced sickness behaviors, those that I just mentioned. Just think about the symptoms of fibromyalgia: widespread pain, fatigue, sleep problems, memory problems, digestive issues, and a host of other symptoms. We experience hyperalgesia, a heightened pain response, allodynia, pain that isn't usually painful, and paresthesia, like tingling, burning, or itching. We have stiffness, muscle spasms, twitches, muscle weakness, especially in the legs, diffuse non-inflammatory swelling of the limbs, hands, and feet, joint pain around where tendons attach to bones and muscles, and temporomandibular joint disorder. Balance problems, slower walking speed, shorter strides are on a level similar to RA or osteoarthritis. Then add cognitive issues like forgetfulness, confusion, trouble concentrating, or difficulty speaking known words are very common. Our fatigue is more than just being tired. It's persistent exhaustion similar to ME/CFS. Sleep issues and disorders are common, like obstructive sleep apnea, restless legs, or insomnia. Many people with fibro have headaches, chronic migraines, dizziness or vertigo, fainting, sensitivity to temperature, humidity, and atmospheric pressure. We can have sensitivity to light, sound, and smells. Many of us have digestive issues like bloating, nausea, abdominal cramps, or IBS. Many have interstitial cystitis that causes chronic bladder pain. Quote, conditions such as fibromyalgia may involve chronic glial cell activation and subsequent production of pro-inflammatory factors, unquote. It's an anti-inflammatory. Here's another quote. Recent immunological evidence indicates that inflammation-driven pathways play an important role in the pathogenesis of fibromyalgia. Immune cells such as macrophages, glial cells, monocytes, mast cells, and neutrophils as mediators of inflammation may have a role in the development of an inflammatory substrate in fibromyalgia, unquote. So microglial activation in the brain is suppressed with naltrexone by reducing the production of reactive oxygen species and other potential neuroexcitatory and neurotoxic chemicals. The anti-inflammatory effect of opioid antagonists may also extend to the periphery, as evidenced by the suppression of TNF-alpha, IL-6, MCP-1, and other inflammatory agents in peripheral macrophages. The neuroprotective action appears to result when microglia activation in the brain and spinal cord is inhibited. Naltrexone does not appear to be dependent on opioid receptors, even though TLR4 is what the majority of researchers have focused on. Astrocytes, a subtype of glial cell in the brain, have also been proposed, as well as opioid growth factor receptor, a protein. Despite fibromyalgia not being considered a classic inflammatory disorder, erythrocyte sedimentation rate, or ESR, which is usually in the normal to high normal range in fibro, showed clinical response to LDN. In a 2009 study, baseline ESR predicted over 80% of the variance in drug response. Those with higher SED rates had the greatest reduction of symptoms with a greater than 30% reduction of pain. And diseases with inflammatory markers also improved. Over 80% of patients with Crohn's disease improved with LDN. Patients with multiple sclerosis or MS, an inflammatory demyelinating condition in the central nervous system, have found improvement in their disease severity with LDN. Also, patients with inflammatory bowel disease and osteoarthritis found relief. So there is an anti-inflammatory effect that's assumed. Research is never ending, thankfully. New research is showing that fibromyalgia is indeed a problem with the immune system. Immune cells such as macrophages, glial cells, monocytes, mast cells, and neutrophils as mediators of inflammation may have a role in the development of an inflammatory substrate in fibro. Neuroinflammation as a potential contributor to the development of central sensitization and fibro may be the trigger. Increased blood-brain barrier permeability is an important feature of neuroinflammation, which results in increased leukocyte relocation into the central nervous system. Recent immunological evidence indicates that inflammation-driven pathways play an important role in the pathogenesis of fibro. LDN appears to be a safe and efficacious treatment option in patients with fibromyalgia. The current clinical data supporting its use are preliminary, however. Dosage, frequency, duration, and outcomes still need to be refined. Well-designed, large-scale studies are needed before LDN can be widely recommended in the management of fibro. That doesn't mean that doctors won't prescribe it. I mean, some of you are taking it. So what's your experience? Do you get about a 30% decrease in pain like other medication? Does it help your depression or fatigue? One thing I usually like to bring up are side effects. There are the potential of several different side effects: dizziness, headaches, difficulty sleeping, vivid dreams, nausea, vomiting, decreased appetite, joint pain, muscle cramps, tooth pain, and anxiety, and rarely an increased blood pressure or heart rate. Confusion, depression, and allergic reactions may occur. However, in most cases, LDN is well tolerated. And from what I've read, it's recommended that doctors start with a very low dosage and gradually over time increase the amount until it reaches about the 4.5 milligrams. So is this something that you're thinking of considering as part of your management of fibromyalgia? I'd love to hear from you. I hope you learned something. I send you gentle hugs and support. Love you.
With you, I can be sad with you. Just take my hand and fly.
Okay. So you have to be there at 4 at Walmart. All right, will do. Love you. Bye. My goodness, I don't know where I was at. I remember. Oh my goodness, he's so heavy. They stated that its effect are unique and low-dose naltrexone or low-dose naltrexone or recent